But we're going to jump into the meat of the presentation, Medicare, the ABCs, what we call Medicare's alphabet soup. So Part A is your hospital coverage. This is the only part of Medicare that is free. It's free if you have worked 10 years or your spouse has worked 10 years. Now, Part A, there is a lot of people that are delaying signing up for Medicare until later in life. They will still sign up for Part A because it's free. You've paid into the system and it gives you additional coverage and puts you in the system and makes signing up for the rest of the parts of Medicare easier later. There is a reason you would not do that, though. If you sign up for Part A, you have made yourself ineligible to contribute to a health savings account. So if you want to contribute to your own health savings account and maximize that, then you don't want to sign up for Part A. You can delay that, but most people do sign up for it. Part B, this is your medical coverage. You go to a doctor, you go to a specialist. There are a ton of different expenses that are wrapped into Part B. And the minimum that anybody is paying in 2023 for this is $164.90 a month per person. This gets netted right out of your Social Security check. So there's no way to avoid that. If you're not taking Social Security benefits, you are billed quarterly or you can set up auto pay. Another note about Social Security, if you take your Social Security retirement benefits you take it early before age 65. Let's say you take it at age 62. You will get automatically enrolled in both Part A and Part B. But everybody else that's not taking Social Security benefits, you must take action and enroll. Part B comes with permanent lifelong penalties if you don't sign up on time. And I'll give you an example. There was a small business owner. He had small employer health coverage that he offered to his employees. It was not creditable. He didn't understand the rules and he worked 18 years past age 65. There is a 10% penalty for every year that passes. He got 180% penalty tacked onto Part B for life. It can get very expensive. Same thing goes with Part D. D is for drugs, your prescription drug coverage. There is a 1% penalty for every single month that passes that you could have had a drug plan and you didn't have one. And that is based on the national average monthly premium. Going into 2024, it's $55 a month. Now, I see more people getting hit with a drug penalty over a Part B penalty, and here's why. They get the letter from their employer saying you have creditable coverage. You can delay signing up for Medicare. They didn't know to ask, is our prescription drug plan here at work, is that creditable? Am I good to delay signing up for a drug plan? So keep in mind two things we want to check on to protect ourselves. Now, the combination of Part A and Part B is what is called original Medicare. And the risk of stopping right there, which you are allowed to, the risk is there are unlimited out-of-pocket costs to the tune of 20%. So you need to get a $50,000 chemo treatment, you owe $10,000. So a lot of people want to protect themselves from those out-of-pocket costs, and so they pick up an additional insurance policy. The choices for most people are, am I going to choose a Medigap or a Medicare Advantage plan? We're going to talk about both today. But let's say you're a former military person. You might have TRICARE for life that will pick up these costs. Maybe you're working for the small employer we talked about earlier, less than 20 employees, or your spouse is working for the smaller employer. You can use that smaller employer insurance as secondary coverage, or your employer might offer you a retiree benefit. Most of them that I see comes in the form of a Medicare Advantage plan, but it's always good to understand your retiree benefit and what it is. We're going to talk about Medigap first. Medigap supplement plans cover the gap in coverage if you were to only have original Medicare. Offered by private insurers like Aetna, Humana Gold, United Healthcare, yada, yada, the list goes on. Part B, the first time you sign up for Part B, you get a 6-month window to sign up for a Medigap plan with no medical underwriting. After the 6-month period, they will do full medical underwriting to determine what your monthly premium will be, and you can be denied coverage. So there is a risk here. The first time you sign up, you really want to think about this because it could be the last time you can get Medigap. Some states have additional protections that the states of New York, Connecticut, Massachusetts don't do medical underwriting all year round. The implication, the Medigap plans are expensive in some of these states. Some states give you protections around your birthday, and they say, hey, around your birthday, you can shop your Medigap plan with no medical underwriting, but you have to have a Medigap plan in place, and you can only go down in benefits, not up. So all states are different, but most states, 6 months from when you sign up for Part B, be it at age 65, be it later in the year, you can sign up for that Medigap plan, no medical underwriting.